this is kind of one of our annual items that we discuss every year, and I will turn it over to Claire Whitley. She will first talk about health insurance, and then we'll talk about, we're talking about property, or just health insurance. Okay, thank you.
Great. Good evening. No? Okay. All right, so tonight we're going to talk about employee benefits. I'm going to give you an overview of the health insurance so you have some context as we move forward in this discussion. And then we're going to go over the employee benefits broker RFP submissions. We recently reviewed and evaluated those. We're going to share those results and discussion items with you. And then we're going to ask for your direction. At the City Commission meeting this evening, this item is on the agenda so that you can give us direction to execute an agreement with one of the brokers. And tonight is your opportunity to ask questions. You can ask questions of staff, of the representatives from the two firms. We had one other submission, but it was disqualified. So we just have these two submissions. Also, I just want to point out that the employee benefits, all the underlying insurance, does not renew until January. So even though we're talking about it, we're not talking about the renewal or changes to that coverage. It's just to give you context and background, because we haven't had a lot of those discussions with the current commission. All right. So the benefits that the city provides its employees are listed here: medical, dental, vision, life, and AD&D, and long-term disability. All of those coverages are paid 100% by the city for the employee coverage. Employees can add additional coverage for their dependents, and the employees pay for that coverage. And then we also have several supplemental insurance lines that employees can purchase for themselves. It's important to note, for this type of insurance, the employee is actually the insured, not the city. So we procure the insurance, but it's on behalf of the employee. And this is a mandatory subject of bargaining. So what that means is similar to wages, how we have to work with the union to negotiate wages. We also have to work on the employee benefits with the union. So if there were significant changes to those underlying coverages, that's something we would work through with the union. We haven't had any issues since I've been here. We've always been able to reach an agreement on those coverages, but just sharing that with you for your information. The broker is very critical in our employees' insurance, and I'll just go over briefly what services they provide for us. Obviously, they help us design the plans that we provide to our employees. The very critical role is negotiate those rates. We're always very cognizant of trying to get extremely competitive rates, not only because the city pays for the employees' coverage, so that is a very large contract, but the employees pay for their dependents, so that cost also impacts them. The brokers analyze our claims data, and this is very helpful in creating programs that increase our employee wellness, and then also results in lower claims and lower premiums. So we're always trying to help our employees be healthy, and financially that helps us as well as them, and it creates a better workforce. The broker advocates on behalf of both the staff and the employees. So the broker very routinely, many times throughout the year, the month, the week, just on a constant basis, we're working together to resolve any billings, claims, inquiries, issues, any problems. Sometimes it might just be the employee gets a bill and doesn't understand it, or maybe they have a question about whether something was billed correctly, or who can they see, what kind of providers they can see. And it's a lot more effective sometimes for the broker to intervene. They can make a phone call directly to somebody that can resolve the issue or answer the question a lot faster than staff can, and explain it to the employee in an understandable way. The broker also leverages their relationships with the provider, with the hospitals, to make sure our employees get the highest level of care. And I say that not, I think every insurance company I've ever worked for provides, very good care. You're going to get quality care no matter who the insurance company is overall, right? But the way that HR and the city looks at health insurance is similar to how you work with your residents, right? Like we can provide, the minimum standard of care, but what we choose to do is provide a little bit more customer service. And again, I just share that with you because talking about the insurance and the broker together is important because that standard of care is what our employees have grown accustomed to and what we want them to receive. So these are just some examples of how our broker has intervened in the past on our behalf. One example this last year was an employee who had some very serious treatment, ongoing treatment for a condition, and the provider they wanted to see was out of network. We were able to obtain in-network rates for that provider so that it wasn't a catastrophic expense for the employee. We've been able to expedite surgery referrals because sometimes those can be extended just because of the demand for care. And in very emergent, sometimes sensitive situations, we can intervene. We've had a couple instances where the employee is just in a situation where they can't manage to pick up the phone. They're just in a state where they can't even reach out for help. So we'll work with either the insurance company or the broker or both to try and be proactive in providing that care. And these are services, again, that we provide the employees, and I think you all are aware of that and supportive of that, and we just want to highlight the importance and success of that. We also have developed over the last few years a health insurance strategy. And that strategy has guided our decision making over the last several years. I'm just going to go over that briefly because this will ultimately come back to you as we renew plans. So it's very good for you all to have a background here. In 2015, the city had an HMO plan through Florida Healthcare. I believe the city had had that plan for many years. I wasn't here, but my understanding is it had been in place for a long time, like many other employers that just had healthcare as a plan. They were affordable, not much excitement there. And then when we renewed it in 2015, we received a 30% premium increase. And 30% is astronomical in terms of health insurance renewals. The increase was due to two things, really. One of them was our loss ratio was over 100%. So Florida Healthcare was paying out more in claims than they were taking in premium. So they were just losing money on us as a client. The other thing was, if you recall, this was the time healthcare was really, premiums were skyrocketing also. So a double-digit increase was not uncommon, but 30% was still very high. So what we did go out to market. Generally every year, no matter what, we'll at least do some soft marketing to make sure that we're competitive. We don't always do a full market every year because you can burn out carriers if you're going year after year asking them to quote. But we'll always do a comparison. This year we really went out to market trying to see what our alternatives were. All of those bids came back to us about 30 to 60% increase. And the reason that's interesting is usually a carrier will provide you a low bid on year one because they want your business, and then they'll gradually increase your rates. And the carriers in 2015 did not want us, clearly. So we knew we had to make a change. It wasn't working. Our claims had just been too high for too long. So in January of 2016, we switched to a high deductible healthcare plan. This was a major shift for our employees. This is probably where we did the most work with our unions to discuss this change and make sure the transition was successful and that financially the impact to the employee was very minimal and that the care for them and their families was really not disrupted. So the big piece of that was to provide a health savings account to make up for that high deductible, and I'll talk about that a little bit more in detail later. But also what we did with the City Commission at that time, we worked with them to make the decision to make the switch to the high deductible healthcare, to talk about funding the HSA, and then to start working on a long-term strategy of what are we going to do to monitor this program, make sure our claims go down, make sure our employees' health goes up. We had quarterly meetings that first year and probably for several years thereafter with the Florida Healthcare Chief Medical Officer and their key staff. So the pharmacy benefits manager would attend that. They would come about six, 7, 8 people sometimes, and we would talk about any issues employees had, any hurdles to care, one thing we like to take credit for, I don't know if you all noticed this, but the pharmacy at Florida Healthcare, if you ever went to the old one in Nova, Nova Road in Daytona, it was very slow. And it was really difficult to get a prescription filled. And we gave them feedback after feedback, and the pharmacy manager was excited and started doing some improvements to those pharmacies. And if you walk into the Ormond pharmacy now, it's tremendously improved, very quick service. And so we've been very eager to try new programs and products out. That's been fun. Okay, so the goal of that strategy, as I mentioned, is to provide cost-effective, high-quality care for our employees and their families. So the cost-effective and high quality. We didn't want to sacrifice one for the other. So with the high deductible, these are the deductibles that we currently have. The employee is at $1,650 a year, and the family is at $3,300. Those amounts are dictated by the IRS. You can go higher, but you can't go lower. We always try and stay at the minimum and not increase those. And then the City Commission has always funded the health savings account in an amount that, if you look at the difference between the HSA and the employee deductible, is $250. And that's the amount of the HMO deductible. So, most of your traditional plans used to have a $250 deductible. I don't know many people do that anymore because it's so expensive, but that was typical of health insurance plans at the time. So we've had that HSA funded just shy of $250 at the employee amount. And then the other thing that we've added in over the years, and this has just grown since 2016, is the wellness incentives. So the commission has approved every year wellness incentives. It's grown up to $450 annually that employees can receive, but only if they participate in wellness events. This can be preventative care visits, it can be fitness activities, it can be health workshops. There's just a variety of ways that they can receive those incentives. So hopefully all of our employees are able to build up their accounts. So if something catastrophic does happen and they are in their deductible, they have the funds even if they have families covered. So we did a lot of statistical analysis on that when we were picking the deductibles and the HSA funding amounts. All right, I'm just going to quickly go over some of the plan features that we currently have. The Extended Hour Care Center is a Florida healthcare clinic. It acts as an urgent care. You don't have to have an appointment to go in, and they are open late, and some of them are open on Saturdays. And what we did is we worked with Florida Healthcare to negotiate a zero copay on that. So employees don't have to go into their deductible to get that. So if they were to go to urgent care, it'd be several $100s. They can go here for $0. If employees go to a Florida Healthcare doctor at their office visit, it's a $0 copay. So again, they're not dipping into their deductible. And these are both very successful, and employees have good relationships with these doctors. One other piece we instituted a couple of years ago, we found that a lot of our claims were due to chronic conditions such as heart disease, diabetes, high blood pressure, high cholesterol. Not surprising, right? Those are just typical challenges. And we created a prescription list. Florida Healthcare created a prescription list for us based on our utilization so that employees could get those prescriptions at no cost. The city actually pays those prescriptions, and the employee can get the prescriptions and get the care and the labs at no cost. And what that does is it gets the employee into the doctor before they have an urgent need to go to an emergency, et cetera, or worse. So that's been very successful. We have a lot of employees that utilize that. Right now, there's 355 prescriptions being dispensed. Annually, yes. The personal health assessment we do every year. We've done this for a very long time. It's not new, but it's just an annual health fair. Coaches come in, Florida Health Care comes in to do different biometric testing. It's to promote preventative care. Every employee gets a report, and it tracks your results year to year. So you can see how you're progressing. You can meet with a coach there. And again, the idea is just to get them in front of healthcare providers, again, to lower the claims, to lower premiums, make everything healthier. And then a fun feature is just the free gym memberships. This is, there's 75 fitnesses in a larger area that are free through Florida Healthcare. Our members have used 29 of those, and we've had over 3,000 visits so far this year. The employees that utilize this office,
That's all for me.
it's just great. So all of those are kind of highlights of the features that we've developed as part of that healthcare strategy over the last several years now. And this chart just shows the premium history, what we think has been a successful strategy so far. So as I mentioned, in 2015, we had that 30% increase. The loss ratio was over 100%. And you can see since then, the loss ratios have gone down significantly. The premium changes have been significantly reduced, very manageable. So over the course of those years, which is about 10 years, our average increase is 2.75% for premiums. And the market rate comparatively during that period is 7 to 9%. So we've, benchmark-wise, we're falling below the average market rate, which is great. We like to think that the strategy, the incentives, all the programs that we've worked on have been successful. If you look, there is one year, 2022, that had over 100% loss ratio. We had 2 large COVID claims and at least 2 large cancer claims that year that drove those rates up. We did, I think it was as a result of that, we had some several breast cancer claims. So we added mammograms as part of the incentive, and the amount of our employees that take advantage of that just went through the roof. It's really surprising. We do skin cancer screening as an incentive as well because of our employees out in the sun, and that's been very successful. We've had a lot more treatments at the earlier stages. We're moving smaller, lesions or areas of skin as compared to the more severe surgeries later. So, what else we have? Okay, so that brings us to our broker of record. As I've shared with you, I believe they're integral in delivering these services to the employees and staff. So when we looked at the 2 submissions we had, as I said, there was 2 qualified, one for Brown & Brown, one from Foundation Risk Partners. Brown & Brown has been our employee benefits broker since 2009, and Foundation Risk Partners is our broker for property and liability since 2024. Both of them have been very successful, and we have positive experiences with both of them, and they're both well qualified. The evaluation committee went through the submissions, and this is what the different categories were that they evaluated them on: qualifications of the firm, experience of team members, references, and price. And these are the results that were scored by the committee. So the total points of Brown & Brown was 100, Foundation Risk Partners was 78, and the main discussion points are noted here. So the first point was just Volusia County public entity employee benefits experience. So Brown & Brown currently has 15 of the 16 Volusia County cities. We thought that was important in those discussions. And 230 public entities. So just the overall firm experience with public risk focus. And then the second piece was the fee. Brown & Brown proposed an annual all-inclusive fee of $50,000, and Foundation Risk proposed their fee altogether was $99,102. They did break that down, $85,000 for the core services, and then $6,500 for compliance support, and $7,602 for benefits administration. And all of those are services that we do take advantage of, so for a total of $99,000. They also, in their proposal, mentioned some commission on ancillary lines, which is not a significant dollar amount, so we didn't factor that in. It's not on the health insurance coverage, it's on the smaller insurance lines, so much lower financial impact there.
And for the record, I will be abstaining from voting on this as I work for Foundation Risk Partners, so I just want that on the record. Where's the scorecard? I never saw that in our packet or anywhere.
I believe that might be in the commission item. It is in the agenda item on the commission item, but I have it here. And I can run through this details with you. Okay, so for qualifications of firm, Brown & Brown had 30 and Foundation Risk Partners received 25. This one. Experience of dedicated team members was 40 and 28. References were 20 and 20. Price was 10 and 5. So that is all I have prepared, and at this time, any other questions you have of staff, we're happy to answer. Anything you have with the individual firms, they can respond to.
I'm just curious the disparity between the price between the two.
The difference is that, so for scoring purposes, what the committee decided was, because they were half, we gave 10 points to one and then half to the other. And do you have a question for the firms about the price?
Well, I guess the services, we're talking apples and apples, we're talking the same service, the same coverage, the same.
Yeah, so the RFP dictates the services,
Right.
which really, we've really highlighted those. Everything we talked about today is the services, the plan design, the implementation, the claims administration, the personal health assessments, developing all those programs, coming to the commission meetings and presenting, negotiating with carriers, just all of that, which we've touched on here today, and then additional. So all of that is the same service. That's what they were required to commit to providing, and they both committed to providing that.
So just for the record as well, I will not be voting tonight, but will enter in discussion. So the most glaring, obviously, we saw 50,000 and 99,000. I guess my question is, and you just asked that one question, is, we saw a history with Brown since 2015. I did not see what their their agent fees were for that period from 15 to 25. Was 50,000 the normal, what they usually charged us, or is this something different?
The previous agreement was from 2020 till now. So
Yeah, it
over
was
that
like 2 or
5
3 years ago.
Yeah, so those 5 years were commission basis, and each line had a different percentage amount. The health insurance, which is the biggest piece, was 3%.
So, I got a question here.
No.
Oh, yeah. Okay.
No, it's just talking about
Do you have the answer to that?
brokers,
Okay.
the broker's fee.
So it was on a commission basis.
Commission.
Previously.
So do we
Yes.
know what we
And
spent?
It, over the course of 5 years, no. If you did the commission for this year, based on this year's premium, it would be about 90,000. But it would have been less than previous years because it's based on the actual premium that's charged.
So essentially, the difference between the two is going to be the amount for the fee. Because the services are going to be pretty much similar across the board.
Yeah, I think the services they provide are stipulated in the RFP, and those are the services both firms are capable of providing. As I mentioned, the two differences are the fee, and from a staff perspective, only a staff perspective in terms of implementing and administrating the plan, the relationships with the evaluation committee talked about, which is the relationships in Volusia County, and leveraging those relationships and having that history that Brown & Brown currently has with those providers.
And there was no staff recommendation on this one?
The staff recommendation was Brown & Brown, just because that scoring came out with a higher number for Brown & Brown. But again, both responded and were qualified, and no issues in terms of meeting the requirements of RFP.
So talking about the scoring and the qualifications, so you mentioned in your report that Brown has more entities in Volusia County. Is that the most imperative thing, or should we be looking at entities in the state? I mean, does that make it or break it? And maybe that's something, the two companies should
Yeah, they
Talk
can,
to
yeah,
us
absolutely. That's a great question for them. Again, from a staff, I have my human resources hat on. So
Right.
just in terms of administering a plan from a human resource perspective and partnering with our providers in Volusia County, we're going to look at that relationship. That factors into our perspective. In terms of relying on what phone calls do we make, how do we get this person care, who are the providers here, how do we expedite that? Those relationships have been beneficial in the past. Again, that's from a human resources, employee relationship perspective.
I obviously want what's best for the employees, but I would like to hear from FRP about what the difference in your premium is going to do for me, your broker fee.
Good evening, Mr. Commissioner, Mr. Mayor, Commissioner. Thank you for the opportunity to speak. My name is John Kern, the Regional Vice President for Corporate Synergies with 30 plus years of experience. I think in reviewing from what our knowledge is of Brown & Brown, there's a couple of differences in our service model. The biggest difference, what I think would justify partially the fee, is our benefits VIP solution team. So basically, we're an extension of your HR team that integrates with the difficult issues that your employees have. Then we come back with a Monte Carlo approach every quarter. So we're monitoring every call that comes in that helps us better consult when we may see a problematic area in a certain issue, right? So there may be a referral issue, there may be pre-certification issues, there may be problems with medication. So this team really is an extension of your HR. The second thing I would point out is the compliance support. We will come in for every one of our clients initially and throughout the year, do a full ERISA or audit, make sure you're compliant, SPDs, all the documents required by law to remain compliant. And then secondarily, I'm not sure who you use for your benefit administration, whether it's ADP or someone else, but the benefit administration technology solution we're offering is to support, build whatever you may have to conduct your open enrollments, integrating with your payroll. So I think those are a couple of core competencies that are different than we're comparing just consulting to consulting.
Thank you.
Does Brown & Brown want to respond to any of that?
Sure. This is Jessica Scott with Brown & Brown. So to answer our consulting services, we do have a team wrapped around all of our clients, including the city of Ormond Beach. So that consists of a compliance team, a population health team, which focuses on wellness initiatives, along with your carrier and myself to come up with strategy, which we've proven we've done over the years with City of Ormond. An account management team. So as John mentioned, we do the same approach as far as when the city employees or team reaches out to us over whatever issue it is with the carrier, various carriers, we engage in that and basically take that off their plate. And again, we use those phone calls and those incidents to try to get ahead of something coming up. We use our local relationships. I've worked with for healthcare for 20 years. So as Claire mentioned, we bring in the management team with our clients, mainly so that there is a relationship with the medical director. We've had many instances where we've had critical things that have come up for employees within the city where I've been able to directly call the medical director to get access to services immediately, and in some cases at no cost at all. They've been able to waive the cost. So I would say our approach is very similar from a service standpoint and what we have been doing over the last 17 or so years. From a technology standpoint, within our fee, we include our benefits administration platform, which the city has used for many years. We also have a technology team that works with that platform. So if any issues arise, we handle those. We help build the platform for the city each year when there's updates prior to open enrollment, and service that as well throughout the year.
Thank you, Jessica.
Thank you. you. I have a question on the resolution that was Claire, you sent me today where we piggybacked off Palm Coast. Can you explain why we did that and what's that for, please? It was a little confusing reading it.
I can, Randy can jump in here if I misspeak. So part of our purchasing process options allows us to piggyback off either an RFP or a contract. And I can't speak exactly to the purchasing requirements there, but it's not uncommon, and we did this a lot more previously than we do now, where we, rather than the city going out to RFP, we look at other cities that have done a similar RFP and executed a similar contract. It's done for efficiency and because you're getting the same material from every responding firm for the same services. We have 16 cities doing the same thing. We're gonna just pool our resources. So that was really is a purchasing method.
Okay. Can we go back to the score? I'm just curious how, and I don't know, do we have the scorecard up there at all?
No.
Like I said, I don't have a copy of it, and I'm curious how, I can understand where foundation lost points for pricing. I mean, obviously that's glaring. But I don't see, that would be 10 points, which would put them at 88 if my math is correct. So it's about 12 points they lost for something else.
Yeah,
Just kind of
I can go
curious
back
about
again.
that.
So I will say there was
a Volusia County Public Entity employee
Experience of dedicated team members.
so
Foundation is 28.
Yeah, 28 and 40. So there was 3 people on the evaluation committee. We did group scoring. So each category we talked about, and we had some variations in how we interpreted the scoring and which factors went into which category. So for example, under the qualifications, between qualifications and team members, there were some variations about which factors were put in each category. Whether you looked at the cities they serviced, so qualifications, like for example, I thought of qualifications as the cities they serviced, as well as their history in working in employee benefits and with public entities. When I looked at the team members, I just looked at their credentials and did not factor in whether they had local experience or not. One of the other team members looked at their team members' experience and did factor in whether they had more local experience or experience in different areas of Florida. And so there was just variations there. But all of the differences in both of those categories really centered around the experience, both the experience locally with the relationship with those providers and the hospitals and the care, and then just the longer tenure, if you will, of ground, not just with the city, but just as a firm. So just that depth of experience. So those were the factors. Was there anything else?
So I think there's some inconsistencies on the scoring because when property and casualty, we didn't give local preference. Now it seems like we're giving local preference. I think there's some inconsistencies in the scoring, and that's fine. I understand. The only other thing that I really have is, and I'm a stickler on this on all of our bids, is having updated insurance in our bid packets. And Brown did not supply an update. I know they have insurance, I'm sure, I'm positive, but when I look at these documents and you look at firms, what they submitted versus this, and that document's missing there. I think every one of our bids, RFPs that come back to us should have updated, whether it's an auto renewal or whatever it may be, should have the updated certificate of insurance in there. I postponed Yellowstone contract a few weeks ago for the same issue. So that's one thing that's missing. Thank you.
Thanks. So you, talking about service, Brown, when the city was going to have a higher deductible at that 30%, they got very creative. And not the high deductible, when the increase was going to go up 30%. They got very creative and did a high deductible plan, which was great, and all the residents benefited from that. Since we don't have the history with Foundation Risk Partners, I'd like to ask John if what would you do to decrease cost and mitigate risk, or what are you doing with other public entities that Foundation works with? What do you do to handle those kind of situations, or what could you offer the city differently?
Thank you, Ms. Tolan, for that question. How much time do we have on breakfast?
Keep it very simple, because we're not all that great in insurance.
Yeah, no, that's a really good question. I mean, there's so many things that are occurring right now legislatively. When we talk about medical loss ratios with the insurance companies, we talk about the new favored nation pricing on pharmaceuticals. We talk about pass-through PBMs, that basically if you take an expensive drug like a Humira and some of these other Stelara, where we're paying $30,000 or $40,000, the manufacturer is providing a rebate. So the new bill, the big beautiful bill, if that's what you want to call it, is now saying that there will be pass-through, and that will be specific to municipal business. So Claire, thank you very much for the history, as I didn't have a lot of that. But, I think there could be significant opportunity for the city of Ormond Beach if we look outside the box, right? And we don't want to like to make changes. No one likes to make changes. But I think this market specifically, with the addition of new players like Curative, with the hospitals challenging each other between Halifax and Advent, I think I would recommend, if I was leading the consulting, that we would look outside the box, right? For example, there's legislation that was passed that I can tell the cost of an Advent hospital versus the cost of Halifax Hospital, right? Would we consider, if we can pay 10 or 15% less at one delivery system, to have planned variations, right? That would mean that we would have to be self-funded, which I thought could be a risk, but after I saw your loss ratios, and I commend you for the job being done, should that be considered, right? We have multiple years at 75, 84, 71, 83% loss ratio. And to the commission, what that means is every $100, they're only spending 73. So can something else be done to keep the integrity of the plan, the zero copays for folks that have chronic conditions? The answer is yes. What we try to do with our clients is find the lowest net cost, whether that's pharmaceutical, with the emergence of biosimilars, right? You take Stelara, $40,000 drug, the biosimilar is now $20,000. We didn't have that for years because the insurance companies, Optum, Florida Healthcare Plan, Cigna, they wanted to keep that money, right? Legislation is changing, so there may be a $10,000 or $15,000 drug. So I have clients in this community that are receiving significant rebates, right? Based on the prescriptions that are being prescribed through the health plan. So I know that's a long-winded answer, but hopefully you see some of the depth of the experience that we bring to the table with an unbelievable team that I have and 30 years of experience. And just, if I may, as far as the relationships, we have significant relationships with Halifax. We have significant relationships with Florida Healthcare Plan. And while I don't live here permanently, we do a lot of business here. And sometimes, bringing in another eye to challenge status quo may be a good thing, right? So I thank you for your time and the question, Ms. Fallon, and I yield the floor.
John, I have a question for you. With trying to reduce the cost of the premium, does that mean that there's a possibility of changing the carrier? And if so, by changing the carrier and or maybe just changing the plan with the existing carrier, will that change the in-network providers that the staff and employees rely on?
I think that was 3 questions.
Oh, yeah, I'm sorry, yeah.
But to answer your question to the best of my ability, so what we would potentially propose if you were to be self-funded, there would potentially be planned differentials. Meaning, if, for example, if our employees went to Halifax, that is a lower net unit cost for the same procedure at Advent. Maybe their benefits are a little better, i.e. lower deductible, lower copay within the legislative means. If you want to use Advent, which is going to cost hypothetically 20 or 30% more, just throwing out a rough number, it all depends on the procedure that is being done, you hypothetically could pay more. So I commend you for the strategy from 2015 and the moves. I don't know what has been considered beyond that, right? We had an issue with a large renewal. We had an issue and we changed the plans and it worked. But what is our next move? With all the potential changes going on in Volusia County, with FHAP and all the other carriers, what's the next move that we can bring to the table to have financial discipline and strategy as we move forward in uncharted land? That's a question I think your broker has to answer.
I have a question for Brown. Have we been using the same provider? And if so, how long have we been with the same provider? This is since 2016, I assume?
Yes, even before that. So since I've been involved with your plan, you've always been with Florida Healthcare, and that has been at the directive of the commission that I've worked with. Now, we have looked at self-funded plans, and I will say when Ms. Shanahan took the role as city manager, she did look at things differently. She was not married to Florida Healthcare, and in fact, she was very much with the vision of let's do things differently, because we started with a $0 deductible plan. So we took baby steps instead of just ripping the Band-Aid and going into an HSA plan. That's where I developed your $250 deductible plan. The idea was to introduce first a deductible because employees had no idea what healthcare really even costs. They were used to no deductible, just paying very small copays for everything. So it was to educate on what does a deductible mean and taking more responsibility and shopping healthcare costs, even with a low deductible like that. Then we talked more and more about HSA, and that was previous to the claim. The claims were ticking up. We knew that, and we were trying to combat those every way that we could. Eventually, we decided the time was right to go with the HSA, and we were able to keep the city's costs pretty much flat by making that move to the HSA at that time. So with that big change, it was determined we're not going to make a carrier change. We're going to keep people at the same doctors, make these plan changes, and see how this plan goes, and really try to focus on wellness, consumerism within the plan. So that's what we've done. We have looked at self-funded plans. Since then, we look at other carriers all the time. And what I will say is, I do have more and more clients looking at self-funding. And in fact, I am the broker for Volusia County School Board, who we have moved to Curative, away from Florida Healthcare for 40 years. That's a big, big deal for them. But we see a lot of value in that plan, and something that I'm doing with that plan right now, because they have now the membership in Volusia County. I've had some other clients with them, but not as large as Volusia County School Board. We are also broker for Advent Health in Halifax. I directly deal with Halifax as well in their plan. So we are working on direct contracts with Curative for all the things John mentioned, to try to mitigate those costs, look at those contracts, and reduce that cost within a fully insured plan. So that's something I'm actively working on right now. And then, as far as self-funding, that's something we look at too, but that would require moving away from Florida Healthcare. And what we have to look at is that you're going from a local, very lean plan to now a national plan. But not to say there's not savings there, because as John said, there are rebates with pharmacy. I feel we have a national pharmacy team where that's all we do is look at contracts, pharmacy contracts all year, and try to mitigate those costs and look at where we can save on those medications. So these are things we're actively involved in. I can just say that the past commission hasn't been willing to go self-funded or make a carrier change, and so that's where we are, why we are where we are today. And that's something, absolutely we have the resources to look at, and I have a lot of experience, working these direct contracts.
Thank you, Jessica. Mm-hmm. Harold?
Yeah, Joyce, overall, our employees are pretty happy with Florida Healthcare.
We have been through changes over the years, but I think that right now they're satisfied with the providers that they have. Most people have had the same doctors for a number of years because we're with the Florida Healthcare plan. I don't know how many go out of network. There are some employees that go out of network for various things like up to Mayo and other facilities, but I have not received any complaints about healthcare coverage, availability, and ability to access to doctors.
So overall, though, I mean, I know a lot of our local doctors are in, a lot of them, many of them are in the Florida Healthcare Network.
As I understand it.
So, and I know both Brown and Brown and Foundation Risk Partners both will work with Florida Healthcare. So, I'll be very cautious about discussing changing providers. I would rather, at least at this point, still with Florida Healthcare.
And that's the reason why I asked that question before, because when you change carriers, then you lose those providers potentially.
Right.
And,
Right.
if we like a certain doctor, a certain type of person we want to see, we don't want to lose that, because then they go out of network, and then that's more of a cost out of your pocket.
Right.
If I may just jump in, excuse me, Commissioner,
Go ahead.
sorry to come up.
Go ahead.
There may come a time that you have to do that. I just want you to recognize that. We had that experience years ago where we had high claims, we just couldn't manage that, and we had to change providers. That's a very difficult thing for employees and families, but sometimes you do have to do that. And I'm not saying that, the year of COVID was tough, and 2 years after COVID, we had very high claims, and we had to think of different resources and ways to work within that network. But yes, you can, it's a difficult decision, but sometimes you have to make that decision.
Probably what Mr. Kern has said too, you don't know what changes Florida Healthcare maybe coming down the road. So I understand we keep those open as long as we can. I think as long as our employees are happy and it makes sense to work with Florida Healthcare, that's where I would be.
May I pose a question? It is my understanding too, and we're seeing that with our clients here, that there are more and more doctors removing or being removed or leaving the FHCP network. So that's concerning to us on several fronts. Also, I think, FHCP is a great partner of ours, but the significant membership they just lost, I'm sure potentially could have some impact on them. And then thirdly, looking at, to your point, Mr. Royce, if win-loss ratios are bad, we may have to look at something like COVID. Whereas in looking, if we were to make a change, we can run disruption reports. We can see exactly where they are. We can put in leased networks that overlay on top of other networks. So we can, pretty much ensure to a certain perspective, again, reimbursements and stuff of that nature aside. But, in looking at your loss ratio, you don't want to just wait until it's bad, right? And then I'll end with, in this market, and Claire, you made some very good points, when you're running hot, you're not going to get many bids. So let's be honest with you. We don't even have Sigma, they're not here. We have Meritain and we have United Healthcare, right? Whereas if we're self-insured, we may have up to 30 reinsurance companies that are bidding on you, right? So if we were to get an increase on reinsurance, it's roughly 20% of your spend versus yielding a 7 or 8% overall spend on, from my numbers and looking at the budget, 4.1 million, right? So that is something that I would ask everyone to consider as you evaluate moving forward. And if I may just add one thing, I'll yield the floor. Thank you. I talk a lot. I want everybody.
I have an insurance background. I've had the pleasure of working for a few of the gentlemen in this room, and I'm very grateful for that. I don't understand half the stuff you just said. However, I'm going to go out on a limb and say we're voting on the broker. They both, I'm not going to negate either one of their experiences. Both of them have a lot of experience. Right now we're looking at the fee, am I correct?
We can give them direction from there. Yeah.
Because you can both provide similar products, correct?
Intellectual capital may differ, but yes.
Okay,
same
I'll
product.
give you that one, okay. That's what we're looking at, correct? You can both provide similar products, we're looking at the fee. But with the renewals coming in January, I don't want the employees to have much change. I know that if I had to scramble within a couple of months, I would probably be struggling. Would they experience change if we were to switch right now come January? Go ahead.
You want to take that? You go first.
I think that was for you, right?
I think this would be the year that we get our arms in a greater understanding of the culture, develop a strategy. So I don't think there would be change in looking at the loss ratios. You negotiate, we would go to market, we would leverage. But depending on what that yield, it would not be our goal to have any disruption the first year.
But the cost to the employees is going to be the same with you? Am I hearing that correctly? I'm just
Yes.
trying, I did personal lines, I apologize, I don't understand EBD.
No, this is me talking
Okay.
here. But yes, the cost would be the same.
Okay.
I have a question. So, yes, we're talking about the broker, right? We know that the product, both companies will probably give us a very good product. And, you know, at the end of the day, we just care about our residents, giving them the best product there is. So if we're talking about broker, and we know Brown is at 50 and FRP is at 99, has either Brown's pretty low, I mean, obviously, we know that. Has Brown or FRP ever worked for performance-based like compensation? If you do a good job, you get paid. If you do a shitty job, a bad job, I'm sorry, you don't get paid. I apologize. I'm so sorry.
Mute that, please.
So delete that. I'm so sorry.
Don't delete it, please don't. It's okay, you're
It'll be blackmail later, I'm sure. So anyway, performance-based compensation, is that a crazy idea, or is that something that Brown's ever done or FRP's ever done?
Yes, we have had contracts such as that.
And do they work to the advantage of, in this case, would be like the city? I mean,
Good. I'm not going to say we do a lot of those. I mean, most of our cities want to know exactly what they're going to pay, and we've had a good track record. So we've never had an issue where we've been questioned on what we make. So,
Well, and for the record, the fee that you're charging, is that normal? Is that a normal fee?
Of these two fees, I think they're both in the realm of reasonableness. I don't think
Okay.
any of them are outrageous in either direction.
because I think Claire said, didn't you say Brown was closer to 90?
It would be if they were doing a commission and.
If they were doing the commission.
Again, it was lower in previous years, so it fluctuated based on the premiums.
Up and down.
But again, we're in the realm of reasonableness.
Remind, we're looking at a term on this of how many years?
It's 5 years total, it's 3 with 2 optional.
Two options,
renewals.
right. I just, remember last year when we talked about the liability insurance, there was a question about change. And we decided last year that if, when you make a change, if you didn't like it, we review it a year.
Yes, but this is a different scenario.
A little bit different scenario.
And actually, property we did different this year as well. So the
Right.
agreement you just signed,
Right.
the last meeting was for the 3 years. instead of
Correct.
2 years.
No, I understand. I just didn't know if, because I know sometimes when you make a change, sometimes if you don't like it, you like the option to go back.
Yes, yes.
easier
I
with
would
PNC.
hope we would not consider an option that we don't feel confident with, because changing a broker is
It's a
very
big deal.
involved, very
Sure.
difficult. It is impactful on employees, it's impactful on staff. So I would not make that change lightly.
Definitely not with EBD. With PNC, it seems like it's a little easier, but
Sure.
EBD, that's affecting negatively or positively impacting employees, which is the concern,
Right, with property, staff absorbs the change.
Yes.
On this, the employees absorb the change.
which is the concern. Okay.
Claire, just for the record, I have the notes for you, but I just want to get on record. So it's a 5-year contract with a 3-year and an auto renewal on year 4 and 5.
Correct.
Okay.
I don't know if it says auto renew or mutually renewed, or
Okay.
I don't know what the language is, but it's 3 plus 2 for a total of 5.
Okay, and the fee stays exactly the same?
Yes.
Okay, thank
And
you.
would we want to think about the 5-year versus less? I mean, I know it's more work for staff to put it out, but it's another,
Well, the renewal
I'm just
rates
throwing it
too.
all out.
Renewal rates.
Renewal is in 2 years?
And throughout 3 years.
Three.
So 3, you would be locked in for 3.
Right. But I'm saying
And
after
yeah.
4 and 5, yeah.
It's just a thought. I'm just throwing random ideas out.
Well, it's 6:25, we have our meeting coming up, so I think that if we don't have any more questions, we try to figure out what direction we want to send staff on this one. Agreed? If you guys want to go around and say some thoughts, whatever, and however you want to do it. Well, I guess it would be only three of us, right? Or is the abstaining members?
All five have discussed.
I have one more question, guys. The fee, when it was commissioned at 3%, was 90 grand over the years. Now it's proposed at 50 grand. You know, are the services gonna be less? I assume not. I would hope not. But you know, that's a big cut in commission that Brown is receiving. And then obviously FRP came in at the 90, which seems like the normal that Brown has been charging for multiple years. So at the end of the day, our residents are saving. I just hope that there's no service gaps, if you will. And that's all I'm going to leave you with tonight. Thank you.
Samantha, one question for you in regard to that. Has there been any issues with service with the current broker that you know of, or has everything been okay, or any feedback on that?
There has been no issues.
Thank you. Thank you.
I do want to say one thing, and Claire did give me this information, but a couple years ago when I came on board as a commissioner, you know, I'm a nurse, so I always like to find out how the service is for all our police, fire. And having some random conversations, I have found out that a lot of our police had to go out of town for some services. Claire was very kind to give me a whole list, and it wasn't as many as I thought it was going to be. But at the time, I worked for an orthopedic place that could have provided those things. So I hope whoever we choose, that all of our employees get served locally if the experts are in town.
Yes, absolutely. We always provide the most convenient care as possible, and that is where, again, whoever the broker is, we expect them to intervene and have the insurance really go to bat for our employees. Those instances were workers' compensation insurance, which is separate from this insurance. So workers' comp has a different network, but either way, we do make sure our employees get that care as conveniently as
Thank you.
Okay. Any other questions? No? Well, I guess I'll go on a limb here on this one. Be the first one to kind of give my opinion. I've had a lot of experience with insurance, with just, you know, going to doctors and carrier changes and all this other stuff and things like that. And it can be complex. It can be challenging. In fact, my ex-wife worked in that type of business. And so, you know, the challenges of dealing with a good broker can be sometimes difficult. Getting a phone call from an employee saying that, hey, they won't take my insurance, this and that. HR is getting a call from the employee, right? You're calling the broker, like trying to get this thing all figured out. But then you look at the cost savings here. You know, it's no secret that I'm trying to save the city money right now. So that's a big factor. And this, and I think the services will probably be very similar, it sounds like. I know both insurance companies just a little bit, just by some of the people that work for you guys and so on. Both reputable companies, I will say that. But I will say that the direction I'd want to go is the one that's going to save the city money. I think it's just suicide for me to say that I'm going to spend more money on, you know, for a carrier or a broker that's going to provide almost similar services to what we currently are going to have or are going to get. So I think that that's the direction I'm going to go, and I'm going to go with the better bid right now. That's the Brown. And that's all I have for you guys. Harold and Kristen.
One of these things, you know, it's a tough decision. I'd still like to have a little time to think about it.
Okay. You have 30 minutes. I know that you did mention 2 weeks ago about saving money on, or trying to pay for that ATV in the fire department and trailer. I think the cost of that was somewhere around the 50,000 neighborhood.
45.
45. So your savings right there is gonna go into ATV.
That's cute.
I'm just, yeah, I know.
Anthony, you can correlate the two.
Can I interject one thing? So we're obviously I can't vote, and I'm thinking about the 50,000 and 99. 50,000 looks way more attractive right off the bat. But I also am thinking about, at the end of the day, do you save more money with a company that may be more creative down the road? Or maybe you don't. Maybe you keep the same program that Brown & Brown has used. And I imagine you've used the same program, right, for the last 10 years? No, you've done different things? So I did not hear that. Tell me
Yes,
what
we've
you've done
definitely shown different things. It's ultimately up to the commission what they wanted to do, but when we talk about other clients, I've certainly gotten creative and done a lot of different things than outside of Florida healthcare.
So we're looking at the broker fee, but the unknown is what the potential savings could be from Brown and FRP. That's an unknown, and you all can't give us those answers either at this point. I don't think any of you can give us an answer right now.
Well, that's kind of my question as far as there's a big difference from 99 to 50, but when you're paying the 99, are they looking for
Other ways of of saving?
Sure.
And that's what I don't know, and I don't know if John or Jessica can give us those answers. And that would be the thing I would think about when you guys are voting, is the bigger picture, not just stuck on the brokerage fee, but I don't like the brokerage fee the way it is either.
I will say for the representative, before you speak, John, is that I can appreciate that, but then I look at the analogy on that, that's putting money in a slot machine, you know? I could potentially win this much, if I only put this much in, but there's no guarantee. And that's the part of it that I'm a little worried about. I can appreciate that fact that we're going to, but I think that either insurance company is going to work on trying to provide us the lowest cost services that are going to be at the highest value. Either way. I mean, they've been pretty good with us, Brown, and they've been with us for quite a few years. I asked the HR if there's been any issues with any kind of, internal stuff. There hasn't been any issues internally. It sounds like Brown made the changes in 2016 with the benefits plan. That was very creative. And I think HSA wasn't that popular back then too. I'm not sure, but I think that was like around the time it started getting more popular. So, like I said, I can't go back to my residents and say, you know what, we're going to spend an extra $40-something thousand because we're going to take the chance of, finding a better cost with our broker with no guarantees. So I think it's just, political suicide for me, and I'm okay with the Brown.
I would add is, again, going back to what their fee was historically, right? And I respect Brown & Brown. They're a good competitor of ours. It's been since 2015 since any other plan designs have been changed beyond an HSA, the high deductible healthcare plan. Additionally, I think, and there may be these conversations, is the way we're funding the HSA, what other vehicles may be available. Ms. Tolan, I don't know if I directly answer your question, but yes, we do work on risk as well. My answer earlier was simply around, I don't want to come in and recommend changes first year, right? And if and whenever you do make a change in consultants, we have to be pragmatic in our approach, understand your culture, and learn what has worked and what hasn't worked. And then bend the curve, bring in more competition to lever Florida healthcare plan to make sure we're ensuring and getting the best deal for the city of Ormond Beach. I respect Jessica's comment about we've tried other things, maybe the other commission didn't want that. But status quo is not going to get us anywhere, right? We have to continue to be innovative. Jessica brought up a very good point earlier that me too. We're in conversations to develop direct contracts with Halifax. that will yield greater results. Ladies and gentlemen, it's about getting lowest net cost in treatment and care with the least amount of disruption we can have. But hypothetically, let's ask ourselves, Florida Healthcare Plan just lost major membership. They're losing doctors. What is Plan B? And you have to consider that in making a decision in how you approach the next strategic planning session to get you to the next 3 or 5 years from the last change you made in 2015. Thank you.
I know this may not have anything to do with, but I keep hearing Florida Healthcare has lost a lot of members and a lot of doctors. Can you give me just a ballpark number of how many members they've lost and how many providers?
Jessica, what was the membership? 7,000?
Well, I mean, you're talking about two different things. So membership, right, is Volusia County Schools, which that's roughly
They
about
left,
6,000 members as of October 1st. As far as providers leaving the network, well, I mean, yes, that happens, but that happens with other carriers as well. So I can't quantify, that's been a massive exodus.
It's not much saying, okay, so you lost 6,000 customers, but the providers you've lost, it would be kind of normal,
I have not seen anything significant, and as a matter of fact, with their new CEO at Florida Healthcare, Volusia County Schools was costing Florida Healthcare money. They were not making money on that account. So by them leaving is actually opening up more funding for them to do more creative things within their network. So that is a direct discussion I've had with the CEO.
Well, correct me if I'm wrong, there's also providers who will say, I'm only going to take Florida Healthcare now to open up for the rest of my Florida Healthcare patients, correct? I've seen that happen quite a bit recently.
Right, and there's employed by Florida Healthcare. So yes, so they can only work with Florida Healthcare members, right?
Okay. I think what I'm stuck on is the fee. I am not opposed to the gamble. I'm not opposed to saying, hey, let's look at the option of shortening the term because we might have more options in a couple of years. I'm not opposed to that. I am struggling with telling my residents, hey, we're going to get, without any guarantees, the same product for more money initially. That's where I'm really struggling. And unless you can convince me that I am going to see a savings like I did in PNC for the higher fee, I'm struggling.
Unfortunately, I can't make that guarantee right now because the goal would not be to disrupt much at all first year. Going into the second year, when we would be more open to change, I do believe that our our creativity would yield a savings. And again, we would be open to enter into conversations into our fee schedule around performance. Now or at a later time.
We have to make the decision tonight.
You don't have to make the decision here. If you would like to table the item, we have time to bring it back. If you would like to.
Help me, Harold.
I'm kind of looking that way.
I think that we should just get it done, but if you guys want to think, the renewal is for January. When do we, renewal periods, the enrollment period starts in November? For rentals? Yeah, so.
The renewal for the insurance is in January, the waiver is in September.
Oh, September, I'm sorry, yep.
There's a lot of lead time leading up to the enrollment. We have time if you'd like to take a vote. We can go to the next meeting.
We got 15 minutes to still decide to.
You don't have to tell us right now. You can tell us it's on the agenda, so you can address it then if you want to table it or
Poker face.
discuss.
It's a lot of information.
It is.
It really is, and if you don't live in that world, it's a lot to You know, I won't be voting, but I also want to understand it, and just like everybody else, we just want to do what's best for our residents, so.
Absolutely, and it's nice to give them lead time, especially if there's a change to come into the role, but these are experienced firms, and they
Right.
will be successful if we wait a little bit. I don't have concerns.
I mean, what else is there to talk about anyway? I mean,
They're obviously not ready to make a decision.
You haven't
No,
lived here
I
and
know.
worked with all of these people in this room.
no,
That's what's hard.
I'm just asking, because the only time we can talk is in here in this room. So I'm just asking what you guys are thinking, because, you know, I can't call you after the meeting and say, hey, you know, what's going on, because we have to do it like this. So the reason I'm asking.
Yeah, I mean, it's something to think about. You know, you got, on one hand, you got 50,000, the other hand, you got 99,000. But your 99,000 folks might be able to save you money. That's what you have to kind of consider. Whereas, again, it's kind of a shot in the dark. They may not. But it's something that, you know. Go ahead, Randy.
Oh, go ahead.
Well, yeah. But,
He's like,
I'm just
We
gonna-
never like that.
No,
I'm just trying to help facilitate moving forward. So,
Yeah.
you know, this is a workshop, so you're not going to make the final decision. It is on the agenda. If you feel like you have enough information to make a decision this evening, then you can do that. If you feel like you want some additional time, then you can table it. You have some time, but you don't have a lot of time. So, what's the timeline, Claire?
I would suggest the next meeting, if we had to push it to September 3rd, we could. That's a short lead time, but again, it's manageable. The burden is on the firm that selected, you know, shorten that timeline. And I think they're both confident they can make that work. So I don't want you all to feel pressured by that.
You could put on the 19th, on the 19th budget?
We could
workshop?
do the 19th for the city commission meeting, or we could do September 3rd. September 3rd.
my preference would be the third one because we have the budget at the next meeting,
You have the workshop.
the workshop.
The budget workshop.
Right.
Yes.
So,
So I'm just thinking, is there anything that we can ask of FRP and Brown, information-wise, to bring to the table to help those that are voting make their decisions, like the plans? We're talking about other option plans or you know, fee history, or, you know, is there, I'm just talking to you guys because you're the ones making the decisions. Is there any other information you think that can be provided to you that will help you make that decision?
well, part of it is they can't project savings. They can't, I mean, they have to go with market conditions, and there's, you know, they can say 99,000 and down the road they could possibly save us 50, but there's no guarantee they could do that either.
So, just going out there again, so I'm
But the
thinking.
possibility exists, they can.
Right, so we know what Brown has done because we've seen it in the packet.
Right.
FRP is new to us. We don't know them like we know Brown and Brown. I mean, they've been a stable forever
Right.
and have done a great job. Is there another, maybe there's another city, I know you're city in Florida, that you can maybe share like in a packet formation like Brown was able to share with us in your creative ways that you saved the city? I don't know, is that something that would be helpful, or am I just making work?
That would be helpful.
Yes, ma'am, we could share a packet to show some of our history and with other clients that we work with in the state of Florida.
Is that something?
That's a great idea. I like it.
So the RFP was very specific to show high deductible plans and the capacity of the firms to do that. Wouldn't it be helpful, I don't know if this is just for y'all, if y'all could see options of where there was, I think to what you said, savings of other plans, because it was very specific in the RFP of how to respond. And I think where y'all are getting hung up on is if we go with a different firm, where would the cost savings be? And I don't think y'all have that proper data. I think that's what would need to be provided.
Mr. Mayor, if I may, I asked the city attorney, this was an RFP that we let. How do we let both firms provide additional information, or how does that work?
So, what you have is evaluation by your staff based on the criteria in the RFP that was met. They provided an evaluation and a recommendation. The question really is, what data are you looking for, and is it within the footprint of the scope of the RFP that was let out, right? Because these weren't the only two firms that submitted a proposal. There was at least one other that was deemed to be not qualified, or not, I shouldn't say not qualified, but it didn't meet the criteria. So the question then is, do you want to open it up, right? That's really what you're asking for additional information. And I think on the one hand, you can say, well, if we're going to keep it limited within the footprint of the criteria that was let out for RFP, then you're probably fine. If you're going to broaden the scope of it, now you're outside the scope of what you issue. So I think there's a little, that's a little risky to do.
It sounds to me, Randy, if I'm not mistaken, what Commissioner Tolan is saying, or her suggestion, would fall within the realm of the RFP. What Commissioner Sargent's talking about might be a little bit more broad, a little bit broader. Is that correct, Commissioner Sargent?
Yeah, what about this as an option? What if we change the time frame from a 3-year with 2 renewals to a single year, next year put out a different RFP? Could you change it that way or no? Or we get way off base?
So here's the problem.
I'm just trying to speed it along.
Right, yeah. But when you issue an RFP, there are other companies in the marketplace that look at all of the criteria, the term, the conditions, the expectations. And so some of them make a conscious decision based on all of that information in an RFP, whether to submit a bid or not. I'm not going to tell you that you can or you shouldn't, but it could change the landscape to some degree. And so the question then is, if you do it, do you open yourself up? And I don't have a good answer for it, right? So if you keep it within the footprint of what was issued, then I think that's a safe space to be.
Does your fee change year over year?
No, ma'am.
So it's consistently the 85 plus the additional fees.
Correct.
After the 3 years, what does your fee change to?
We've kept it the same.
It's going to stay the same 50.
Yeah, that's how we
Thereafter.
responded. Yeah.
Okay.
To the RFP.
Okay. Do we want to come back on this in the September workshop? September 3rd, I believe it is.
Well,
Oh, sorry.
I just want to clarify, do you want a follow-up workshop?
Is that what you guys are asking for, a follow-up workshop? I mean,
I just need time to think. Just
you see time to think? Okay.
So is it, you want us to bring it back at the next meeting, you want us to bring it at the 13th of February?
There's August 19th or September 3rd, and if you would allow me just to look at the timeline frame, can we touch base individually in the next week or so? And then you will have had a little bit of time to think about it. Let me know if 2 weeks is sufficient or if we need to push it out till September.
Okay.
I would look at it September 3rd.
If prefer that.
And are we getting additional info, or did Randy mix that?
I think it's
Trying-
challenging. It
No, I
sounds-
think the additional information, I think what you were pointing to is okay because it falls within
Right.
the RFP. If we go with Commissioner Sargent's idea and you go to a different type of program, different type of plan, that would probably require submitting a new RFP.
So you're
which would-
looking for additional info within that RFP?
Correct.
Okay.
For maybe some examples with the Foundation Business Partners where they've had this type of program, but they've actually able to save a municipality money
Right.
on their insurance.
And I believe some of that is included in these vehicles within the RFP responses. So I'm not sure what we're asking for in addition to.
So what I was referring to is Brown talked about Edgewater and what they were able to do, and that was a big chunk of the packet. I didn't see that with FRP, with that entity that they had and what they were able to do. And I think that would be, if it was me making a decision, I would like to see that as well. And if Brown wants to submit something else, I think it's perfectly right that they should be able to do that as well. I'm not trying to single out one company. I'm just trying to help you guys make your decision.
That is thunder, by the way.
It sounds like we're just going to table this at the commission meeting for now.
Yeah, that's what it sounds like. Okay, Tracy, got it?
I got it.
Okay, is there anything else to discuss before we adjourn? Seeing nothing, thank you all for being here. Thank you, Foundation Risk Partners, and Brown & Brown also, and we'll be back in touch.